guys. I watch Dr. Greger's question and answers that he does once a month. And a lot of times it's just the same questions over and over, or questions where I know the answer because I've watched his other videos. But once in a while, there's a really good question that I haven't heard him cover before. And I think this was the June question and answer of 2018. And I've been meaning to make this video for a while, and that shows you how behind I am on my little list of things that I want to talk about. So, the question was, and let me see if I can get this right, because like I said, I'm going from memory and it's been quite a while. The question was, do you have to exercise to be healthy on this diet? Or, can you just lose weight naturally through the diet and be healthy because you're losing weight? Something to that effect. But the answer surprised me, because you always hear these doctors say, if you just eat the food, you'll lose the weight. If you just eat the food, with moderate proportions, of course, the weight will just fall off and you'll be healthy on this diet. And if you hit a plateau, then, get some more exercise, go for a walk around the block or whatever, and that'll get you through the plateau. So Dr. Greger's answer really surprised me. And if you follow Dr. Greger at all at nutritionfacts.org, you know when he does his question and answer or his lectures, he's walking on a treadmill, and he's got his camera set up, in front of the treadmill. And I don't know if that's a camera or laptop, whatever it is. But he's walking on that treadmill. You never see him just sitting and talking to people. And so I was very curious about that. I mean, yeah, it gets your steps in, but what's the reason why he's never sedentary? And so his answer was, a sedentary lifestyle damages your endothelial lining of your arteries. The blood is just kind of sitting and it's having a hard time moving through the body, and that damages that endothelial lining. Now, I'm not a doctor, I'm just going by what he said, but if you think about that, that makes sense, and that's directly related to what I wanted to talk to you about today. And that was how I lowered my blood pressure, okay? Now, I did this diet for a good 6 months, and I wasn't really seeing that much of a change in my blood pressure. I felt better, and I could move better, and I could stand longer, and I had a lot less pain. And I went off my cholesterol meds, and I went off my pain meds, but I was still holding on to that blood pressure medication. And it was a 2-part medication, a diuretic and blood pressure medicine combined into one. And at times in my life, I even had a 3rd medication for my blood pressure because those 2 didn't lower it enough. So a lot of people are really curious about how I did this, and they need this motivation and these talks about lowering the blood pressure, because a lot of people are still on this journey or just starting this journey and trying to do that. And we know that being thin doesn't always mean healthy, and being thin doesn't always mean that you don't have pain. So they are linked to a certain extent, but not all the way as to say, oh, once all the weight comes off, everything will be great and I won't have any more pain. The damage that you've done, the injuries that you've suffered, though, that scar tissue is still in your body, and those things are still going to hurt. Okay? You're still going to have some pain. You may not have it to the extent that you used to. You may feel better, but those injuries are still there. And then with the blood pressure, what I saw was, it wasn't until I directly linked my salt intake to my inflammation. So I realized that salt was causing me to swell, my hands were swelling, my joints were swelling, and that was causing the aches and pains. And It wasn't until I realized that I needed the aerobic exercise to get my blood moving and pumping that my blood pressure actually went down. Now, I had to give up my coffee as well, and of course I still have my tea, and once in a while I'll have some decaf coffee. I try not to have it often because it will raise my cholesterol again, which I don't want to do. But once in a while, just for the flavor of it, I'll have some decaf coffee. But my point is that it's all kind of meshed together. It all rolls into one. So I can't say I gave up salt and my blood pressure went down. I gave up caffeine and my blood pressure went down. I started exercising and my blood pressure went down. I adopted a whole food plant-based diet and my blood pressure went down. It's all linked in together. And it took all of those pieces to that puzzle before I got off of that blood pressure medication. So now I'm off of 3 different blood pressure medications. I'm off of cholesterol medication. I'm off of 2 different pain medications. I'm off of that aspirin a day just in case I get heart disease, because of course I was on the road to heart disease. I'm off of that, and I'm off of the blood pressure medications, and that was my ultimate goal. All the rest of it was just added bonus. My main goal when I started this was to get off the blood pressure medicine. So back to what Dr. Greger said about damaging the endothelials if we're sedentary. Yes, we can eat this diet and the weight will come off. But if we want to be truly healthy, we need to incorporate some exercise. Now, for some of us who are disabled or have injuries or whatever, that can be really tricky. So you can't always just go for a walk because maybe you have scoliosis or your hips are out of line, or you have back problems or arthritis or whatever it may be, and I have all of that. I do water aerobics in case you missed those videos about that, and I do those twice a week for 2 hours each day that I go, so that's 4 hours of water aerobics, and that has helped me with my blood pressure. I also do squats in the house, and I lift little dumbbells in the house. So if I am sitting at the computer for a long time or watching a movie, hanging out with my daughter, or playing cards at the kitchen table, which is what our family likes to do right now, I try to make sure that I'm moving around a little bit. You know, just stretch and move your arms. If I'm sitting up and my feet are up, I pump my feet back and forth a little bit. You know, I try not to just sit for long periods of time. I try to do anything that I can to just keep that blood moving, because it's important. It's important for preventing heart disease. It's important for keeping the blood pressure low. And it's important for my mental health as well, to just keep moving. So have a good day, guys. And if you missed any of the other videos that I was talking about, just search through. I've got lots of them, and surely there's something that will appease you. Have a good day.